Hi, my name is Jacqueline Olson. I'm an occupational therapist assistant attending the master's program at Kaiser University. And I am presenting a case study on a little girl named Julia. She is diagnosed with Charcot-Marie tooth disease. I'll provide Julia's history and context, occupational areas of concern, characteristics of the disease, and primary assessments and interventions that would be appropriate for this diagnosis. And finally, I will provide frame of references that an occupational therapist may utilize to guide treatment approaches. Julia has recently been diagnosed with Charcot-Marie tooth disease. And some of the symptoms of this disease is that it affects the peripheral nerves. It's a degeneration of the peripheral nerves, and it leads to muscle weakness in the upper body and the lower extremities. It affects their overall strength. They can have chronic pain, repeated ankle sprains, a foot drop, hammer toes. It can even affect their vision and their hearing and their ability to feel different sensations, like if the stove is hot or something very cold. So there can be a lot of safety risks with this disease as well. First, I would like to start with Julia's history. She is recently diagnosed with Charcot-Marie tooth disease, and she is starting occupational therapy. Her mother noticed that she was having frequent falls, difficulty with grasping and manipulating items, and that she was not developing as fast as her cousins or other children. At this time, she does not have any adaptive devices, and the family is searching for help within their home. Julia will be starting kindergarten. She's 4 years old, and she'll be starting kindergarten in the fall. Some important things to know about Julia's home life is that her mother works a lot. She has 2 jobs, and her grandmother is the primary caregiver. Some things that makes it a little bit difficult is that her grandma is struggling with mobility herself, and that has added a little bit of stress within the home. Her mother and grandmother both report that they would like for Julia to be more independent with feeding herself and even basic hygiene like washing her face and helping to manage her clothing. Her mother is concerned that when she starts school that she is going to have difficulty with her schoolwork and has a lot of questions. So part of some of the things that we're going to be doing in our sessions is a lot of family education as well. So one thing to know about Charcot-Marie tooth disease is that it is a group of hereditary disorders that damages the nerves in the arms, hands, legs, and feet. It is caused from a gene mutation inherited by both parents, and it mainly affects the normal function of the peripheral nerves. Some common symptoms are neuropathy in the upper body and the lower body, muscle atrophy, tremors, hammer toes, foot drop, and difficulty breathing. It's also associated with, people, they drop items frequently, falls, and balance, and the severity can differ quite a bit from person to person, and it is very individualized with what the individual symptoms are. For Julia, her mother reports that she has had lots of falls. She fatigues quickly when she's playing or just walking in the store. She notices that she struggles with holding objects like her fork and toys. and also that she stumbles frequently and falls. I had mentioned that already. Okay. Two significant areas of occupational concern for Julia would be her activities of daily living, her ADLs, and education. So first, activities of daily living are most definitely a concern for Julia because she is demonstrating difficulty with self-feeding, with her ability to grasp the fork. She's using her fingers more for self-feeding because she is unable to grasp the utensils, which could be due to a lack of feeling from neuropathy in her hands, and also she demonstrates tremors in her hands as well. She is not dressing herself. She's not initiating because her mother has reported that when she does start to attempt to zip up her jeans or button the buttons on her shirt, she is not able to do that, so she has stopped trying and is not interested in initiating those tasks. And education would also be a concern because she will be starting kindergarten, and some typical expectations that you would see in a kindergarten child is that they are able to sit and they have enough stamina to sit in class, sit upright in their desk, and able to grasp and hold a pencil and color and starting to use scissors. And so those will definitely be an occupation of concern for her. I want to highlight some typical developmental development between the age of 4 and 6. So children are usually, they are at between the ages of 4 and 6, they're able to grasp pencils, stabilize and grasp a pencil or markers and crayons. They are able to maintain posture, sitting posture at their desk. They have the coordination to complete multi-step dressing tasks. They have the endurance to play with their friends and usually quite a bit of energy throughout the day without needing lots of breaks or rest breaks. And they're able to throw and catch balls without losing their balance. So those were some typical age ranges from 4 to 6. And so there, Julia is demonstrating some occupational delays and some developmental delays in those areas. A child's ability to meet outcomes and progress towards their goals is correlated to the occupational therapist's assessment and interventions. It is really important to consider the age of the individual, their weaknesses, their strengths, and what's important to the family, what's important to the child when choosing your assessments and your interventions. Knowing that Julia is a 4-year-old child going to be starting kindergarten in the fall, we're going to look at different assessments that can help her meet her goals. Knowing some of her developmental delays and occupations and her grasp, her difficulty holding items, and falls, delays with her occupations of getting dressed and feeding herself. The Peabody Developmental Motor Scale would be an appropriate assessment to use. It has 6 subtests, and it focuses on children from birth to 5 years old. It's going to look at the reflexes, stationary, locomotion, object manipulation, grasping, a visual motor integration, and another important assessment, another good choice would be pediatric evaluation of disability inventory. And that's going to assess functional capabilities and their performances, their functional performance or rehabilitative progress. And then lastly, we have developmental assessment of young children, second edition. That is another assessment that would be appropriate, and that looks at cognition and communication, social and emotional development, physical development, and adaptive, which are all going to be very important for some of the interventions that Julia would need with her diagnosis, which is a progressive diagnosis, and looking at different adaptive hygiene, self-care, built up utensils or pencils, different methods for her to be able to be more independent, and environmental modifications. So an intervention that would be good, assessing and trialing adaptive devices. Some other interventions that would be appropriate and very necessary is family education on the disease process and techniques to increase Julia's independence with self-care. So the family, her mother and grandmother, primary caregivers, have voiced their concerns. They are very unaware and uneducated in the disease that she's been recently diagnosed with, and they have a lot of questions, and they have a lot of struggles within their family right now. So education is very important, and also just targeting bilateral hand grasp, strengthening, upper body strengthening, for just to help her to get a little bit stronger and reduce any chances of declining. Frame of references guide therapists' treatment and reaching the child's goals, the family's desired outcomes. It takes in a holistic approach, looking at the child as a whole and focusing on their remaining capabilities. Many times when you take the rehabilitative frame of reference approach, the impairments of the individual are likely permanent, and it focuses on their occupational environment. So for Julia, that would be her school and her home. And it looks at the physical, social, and emotional aspects of the individual. A biomechanical frame of reference, another frame of reference would be a biomechanical frame of reference. And that's going to target strength, endurance, range of motion. The biomechanical frame of reference prevents deterioration of existing movements and prevents contractures. And these would be very important for Julia, with her knowing that her diagnosis is a progressive disease, and targeting her strength, her core, posture, her range of motion, and her stamina would be very important for her to be able to sustain her endurance throughout class. Again, she'll be starting school in the fall, so that would be very important for her. Playing with her friends, and just overall getting through school and her everyday activities.